Hi everyone, Dr. Remy from Pain Free and Fit. Today we're going to share with you the most dangerous exercise for those of you with spondylolisthesis and lower back pain. You'll want to avoid this one at all costs, and we're also going to show you a modification to learn how to move your legs correctly, hip flexion, where you don't irritate your spondylolisthesis lower back pain. Enjoy. So, treating patients with spondylolisthesis for the last almost 30 years, especially with my workout, fitness people, and my sports-related injury patients, I have come to realize that there's one exercise that's the most dangerous for this type of patient above all other exercises, and that's the leg raise. Whether it's done lying face up, raising one leg, raising two, Pilates hundreds, hanging from a chinning bar doing leg raises. The problem with leg raises is that most people don't have stability in their lower back, and the spondylolisthesis, the vertebra that's already slipped forward in the spine, becomes pulled more forward because of the psoas action, the muscles from the leg bone that attach up to the front of the discs on the vertebra. So what I like to teach my patients, and I'm going to share with you today, is a modification to still learn how to bend your leg forward, because that's an essential part of walking and climbing stairs, but learn how to do so correctly with proper usage of the hip musculature and stabilization of the lower back. So the first thing you need to do is set your alignment up. If you have a tendency to rotate your pelvis to one side while you're exercising or standing, or leaning your rib cage to one side, or slumping down, you need to correct these alignments. We always say in Pain Free and Fit that unless exercise is tailored specifically to your body, you're usually going to be strengthening your dysfunctions with exercise, because you're going to use the same movement patterns and tendencies that you do all day long. So if you're not sure about what your alignment are, I invite you to go to the Pain Free and Fit or Posture Size websites and take the free body analysis to figure out what your alignment issues are. Once you have your alignment set, so you're in a good square neutral position, you're going to engage your core, your transverse abdominis by pulling your lower tummy in, and your multifidus by thinking that there's a little bulging out on both sides of your vertebra in the back. That's another video. If you haven't learned how to engage your multifidus, you can find that one on our channel. There's a multifidus section for spondylolisthesis. We're going to hold a little tailbone under tension, so we rock our pubic bone upwards and our tailbone under, and that's going to flatten the back slightly. We're only going to do that to a point where the back feels comfortable. And then what we're going to do, once that back is stable, we're going to learn how to move the leg by using our glute muscle or buttock muscle to draw the hip bone backwards in the socket. We're going to put our finger on the side of our hip, that hard golf ball-like bone, put one finger behind, one finger in front, and exert a tension backwards with that thigh bone into our bottom finger as we bend our knee up. And as you practice this, you're keeping your lower back rather flat, all your core muscles engaged so the spine is stable without that vertebra coming forward. And now you're using a recruitment pattern that's emphasizing the glute muscle to stabilize the hip and not overutilizing the hip flexor muscles, which is common for a lot of people with spondylolisthesis, which then draws too much pressure on the psoas and pulls on their spine. So that's a great exercise. What I suggest is doing it with the knee bent as opposed to straight-legged. That's much more advanced. And by bending the knee, that's more of a typical functional pattern that we all use during the day, from climbing stairs to walking. So building those reps up for endurance, reps of eventually 20, 30, 50, and 100, will help to hone that normal recruitment pattern, avoid the tendency for the bone to slide forward with spondylolisthesis, and help a lot with your pain. If you like this exercise, I invite you to subscribe to our channel. We've got a lot more videos that are centered on lower back pain and especially spondylolisthesis. You can also visit our website, Pain Free and Fit. We've got a bunch of great information there. And if you have any questions or comments, please feel free to leave them below, and I'll do my best to answer you. Thanks, and I'll see you next time.